I've never wanted to do anything different besides the medical field. I love helping people here in our community. It's part of who I am, you know, it's not a career, it's just me. We provide a skilled nursing service. It's our role to help bridge that gap between the hospital and the home. My work schedule, it's much more autonomous. I get to get my kids on the school bus. I get to do the morning routine with them. I get to pack their backpacks and talk about the day. The timing's perfect because they hop on the bus and I'm dialing huddle as soon as they get on. And all the nurses who are scheduled for that day, they discuss the patients they saw yesterday. They talk about the patients they have scheduled for today. Supervisor's on there with you. The scheduler's on there with you. So it's really a team, holistic approach. You meet with your manager and your supervisor and the scheduler once a week, and you sit down and you have that one-on-one time to talk about your patients. Where are they at meeting their goals? What are the frequency of their visits? A typical day consists of seeing about 6 patients. Try to get it scheduled in between 8:30 and 9:30, the first patient. I spend about 30 minutes to an hour in the home. A routine visit is, okay, what's happened since the nurse saw you last? Have you had any problems, any falls? We go through, you know, the whole head-to-toe assessment, and we move on to the next visit. Do they all go as smoothly as that? No. Sometimes you will go and there is a big issue where they need to go to the ER. So sometimes, yeah, your schedule doesn't always go as planned, and that's okay. That's nursing. In home care, you know, it can be a struggle. You're calling the doctors a lot and you're making notes. It's not always pretty. There are hard times, but the thing I like is the relationships that you build with the patients and their families. Seeing them progress from where they were at the beginning is wonderful. As far as what's a good team member, I think, you know, you have to obviously want to help. You want to be able to jump in. You have to be willing to train new nurses. The top 3 benefits transitioning to home care, I definitely would say the morning routine. I do like the autonomy. The other is the education piece. Just having that time without your beeper going off, without having to pass this med, that's really rewarding.